A lark is a type of bird, I believe. What is a lark?
What is a lark?
What is a lark?
What's a lark?
What exactly are LARCs?
LARCs are long-acting, reversible contraceptive methods. That's what it stands for. The cool thing about the LARCs are that you can put one in and you don't have to worry about it for years, okay? And so that's the real benefit for people.
I think most of my friends that were pregnant were usually in a relationship with their boyfriend and they felt like they didn't need condoms or they just didn't like the feel of them. I think most of my friends wouldn't be able to pick out the implant or the IUD because they don't really pass information about it. They're not really aware of those methods because they're not as advertised or as talked about.
Well, there are several methods that fall into the category of LARCs. One of them is the intrauterine device, or IUD. And some of the brand names you might hear for that are Mirena, the T, you've probably heard that, or Paragard, which is a copper device. And then there's another method called the implant, which is basically a single rod implant that goes inside of the arm. And the brand name for that right now is an Nexplanon.
Do their parents have to sign for it?
Parents do not technically have to sign. What I would say is that because it's a little bit of a procedure, it's a little more than your typical procedure, I do encourage adolescents to talk to their parents, often if there's mothers, talk to their mothers or father if they are closer to their father, about having the LARC placed if they can.
The misconceptions that most teens have about LARCs is it's painful when they insert it in. It's really expensive.
We place the device, which is basically the size of a quarter. We place it inside of the uterus very gently, and that takes probably the whole procedure about 3 minutes or so. We place it inside of the uterus, make sure that it's properly in position, release the device, and we're done. With the implant, when you come into the office, we basically place the device in your upper arm. It's between two muscles in your arm, but it goes right beneath your skin. And what we do is we take a little bit of numbing medicine with a needle and we inject it at the site where we're going to place it. And then we very gently place the device beneath your skin in the area where we have injected the numbing medicine so that you don't feel it and so that it's comfortable when we place it.
Are there side effects of the IUD?
What are the side effects of an IUD?
They're a little bit different depending on the type of IUD that you get. The main side effects are primarily cramping and bleeding. You can see some irregular bleeding and spotting up front and even some spotting in between periods, but typically over time, within months, people tend to have lighter periods and some even stop having periods altogether. It's important to know that in terms of side effects that the implant, you can also have some irregular bleeding and spotting. For most people it is actually lighter, but you can still have that irregularity over time.
Price can be a problem as well, but it may not have the funding to.
Or they might not know where to get it at.
Most people have health insurance.
A LARC is always going to be a medical procedure, so your insurance should pay for it. Also, places like Planned Parenthood have special programs for people with low income and things like that, so they would help you out paying for it.
How effective is the LARC?
Do they work?
I think that IUDs are 99% effective.
The IUD and the implant are 99%. That's 99% effective.
So we hear all the time people are getting pregnant on pills because they missed their pills, and so that's why it doesn't work. That's not as effective. In terms of the LARCs, it's in there. It's 99% effective. So there's this 1% very small chance that could occur. I can't tell you it's zero.
Right.
Okay, but it's a very, very small chance. But STDs, HIV, none of these methods will prevent you from having this. You still have to use condoms to prevent sexually transmitted infections, should you choose any of the methods.
Alright, so where do you get this stuff? Like, it sounds hard to get.
I mean, you can go to your doctor. Your doctor will have all this information. You can go to a clinic like Planned Parenthood, or you can go to this website, knowwhatyouwant.org, and they have a nice long list of places where you can get this at.
Check out knowwhatyouwant.org to find out more about LARCs and other ways to prevent pregnancy. Remember, you choose.